With vaccines readily available and more states easing their COVID restrictions, it may feel like we're slowly getting back to normal.
Slowly but surely, but we are just 4 months removed from the deadliest stretch of this pandemic. So where do the numbers stand? Gabe Cohen dug through the data.
Right now, much of America is reopening thanks in large part to the vaccine rollout. But what does the data say about our progress? Let's verify. Has the daily COVID death toll hit a pandemic low in the U.S.? Our sources, CDC data, and 3 infectious disease experts. The numbers are complicated and imperfect, but here's what we know. This is a CDC graph of COVID deaths throughout the pandemic. As of May 1st, the weekly average showed 633 deaths per day in the U.S., an 82% drop from the record high 3,400 daily deaths in mid-January. But it's not the lowest total of the pandemic, just barely. For 2 days last July, the average dropped below 600 deaths per day, just 8% lower than right now.
We are coming down so fast right now, which is very good. But no, I wouldn't say we're at the pandemic low, but we're very close to it.
Dr. Ali Mokdad works with the Institute for Health Metrics and Evaluation. They do COVID data projections. They're predicting the daily death count will drop another 80% by late summer, nearing 100 deaths per day in the U.S.
But never near zero, simply because people are refusing to take the vaccine.
The death toll is dropping faster than the caseload, largely because more vulnerable people are vaccinated. CDC data shows roughly 35% of Americans are fully vaccinated, but 72% of those 65 and older have their shots, an age group that makes up 80% of U.S. COVID deaths.
Our main goal with our vaccination program is to reduce hospitalizations and deaths.
Dr. William Moss heads the International Vaccine Access Center at Johns Hopkins School of Public Health.
We're not going to get it down to zero, just like we don't get influenza virus deaths down to zero. But I think we can get it down to very low levels.
But our experts say that progress is at risk in the months ahead, especially with widespread vaccine hesitancy.
One of the biggest threats is a variant that is less susceptible to our current vaccines.
Dr. Saad Omer, the director of Yale Institute for Global Health, says pockets of unvaccinated Americans and worldwide outbreaks like the one in India could breed one of those variants.
As of now, does a variant like that exist?
No, the current vaccines that we are using in the U.S. seem to be holding.
Even without a variant, Dr. Mokdad's team at IHME is projecting a small surge in deaths next fall and winter.
Because it's a seasonal virus.
Vaccines and masks, he says, will be key to prevent a steeper spike.
We need to be vigilant